So, hello everybody. This is the Apply Club Health. I'm Heinrich Schwartz. The Apply Club Health is part of the Applied Anthropology Network, which itself is part of the European Association of Social Anthropology. We are a platform that explores how an anthropological lens or mindset or sentiment um, can help us to explore how to better understand and rethink healthcare. We've been doing this now for 3 years almost, a number of speaker events over time. For 2026, we want to do a little bit of a shift and explore more deeply what responsible and sustainable and equitable healthcare means in this context here. So let's see how that evolves. With me from the team is Margaret Jaeger. Maybe Margaret, you can wink. There's also Annie Lampler, who will remain unseen because she's with her child, but she's new to the team, so we welcome her specifically. And to do a little call for team members, we would be happy to invite new team members who help us organizing these types of events. So if you want to be part of this, you're very welcome. You know how to contact us. The reminder after the talk, we have a discussion, and usually we do live discussions if we can. So raise your hand if you don't want to, put your question in the chat, and then we can read it as well if you don't want to talk. So thank you, Brandy, for being here with us. We met at EPIC in Helsinki and had a good conversation. So that was kind of the reason for this invitation. We talked about AI a little bit and also how to do this in more responsible ways. And this is exactly what we're going to hear.
Yes, thank you. Thank you for having me. I'm very happy to be here.
And I have a question. What were you thinking about in the photo that you sent us, where you are laughing so probably loudly, which of course is not seen in the picture? Yeah, exactly like that.
Like that.
Roughly. Yeah, like that.
I don't know. I was actually this was at a really lovely conference for work. I was doing some work with nurses and nurse innovators, and I got a chance to sit in on a conference that some nurse innovators were having. And I don't remember what was said that made me laugh, but they were taking headshots, and they were kind and generous enough to have me do some as well. And so they were all standing in the background, and it was just such a supportive environment for everyone to take headshots, and they were all just making jokes and cracking jokes. And so I don't remember exactly what was said, but I definitely remember the feeling of all those amazing women. And it was a lovely time.
Okay, it's a great picture. I really like it.
Thank you.
So a bit more serious now. Quick introduction. Brandy Parker is a senior design director at a very obscure little company that probably nobody knows called IDEO, specializing in healthcare innovation, more than 15 years of leading global research and design initiatives across digital health, medical devices, and last but not least, patient experiences. From foraging elderflowers in Norway, I'm really curious to hear more about what that project was about, to shadowing core teams in Midwestern hospitals, which is less unexpected. She seeks out the patterns and unspoken needs that drive more equitable and human-centered solutions. So we're looking forward to that. She teaches human-centered design at DePaul University and speaks regularly on the future of health design. The talk explores how we can design health AI that doesn't turn us into data points. We're really curious about that. It's called Beyond Optimization. And I'm delighted to hear you talk. And my choice of words is not coincidental, as we will see. Delight plays a part in your talk. So Brandy, please.
Thank you. Thank you, Heinrich. Okay, so to kick things off here, I have a bit of a question for the audience, and you can just think about it in your head. What happens when organizations can infer more about our health than we can? Often from data we never experienced as health data in the first place. This is no longer a hypothetical situation. In many cases, this is already happening today. How does that feel to hear that? Not morally, but physically, how does that feel in your body? The asymmetry of knowledge is a felt experience, not just an abstract ethical consideration. The default story right now around health AI is often framed in terms of optimization. And so it's all about efficiency and prediction and risk scoring and compliance. And optimization isn't wrong. It's very important that we try to optimize our healthcare system, which is not currently, in many ways, it's currently not very efficient or optimized for humans. But optimization also isn't neutral. Optimization is a design stance. And we often don't think of it as design stance. We just think of it as the given and the main goal. But it's actually a design stance. And it's not the only design stance that's available to us. There are actually other design stances we can take within health AI that could work with optimization or as an alternative to optimization as well. So let's think about what happens when AI-enabled systems enter people's lives as an authority, which is often in a way that is very quiet and without meaningful informed consent. There's sort of this awkward future where companies know more about our health than we do, right? And so let's think about something that happens every day, which is an insurance company analyzing claims data, what services are billed and when and for what, and then using predictive models to identify people who might benefit from outreach. So some of you may be from the US and some of you may not. So you may or may not be familiar with how the US health insurance system works, but bear with me. Increasingly, insurers use health data to trigger outreach that is framed as care management. So health coaching, supportive services, getting folks hooked up to things like that. So some of you, has anyone here received one of those calls? Has anyone ever gotten a call from their health insurer like that? Okay, well, they tend to follow a major health event or a significant health expense. So it could be an emergency room visit or a new diagnosis or a change in medication. And these interactions have a high potential for awkwardness for several reasons. First, there's this felt experience. If you're thinking about it, there's this felt experience of something like surveillance. Who are you? Why are you calling me? How did you know about this? There's something that is maybe possibly deeply personal is suddenly experienced as public, or if not public, at least institutionally visible. And you may, you know that your insurance company knows things about you, but it's different to then get a call about that. And second, there can be this statistical confrontation. You're essentially being introduced to a model's estimate of your future, your predicted risk profile, sometimes before you have had time to process what's happening with your own body or your own life. And third, there's this kind of economic subtext, which is, implicitly the system is saying you are a financial risk or potentially a financial risk, right? You may cost more now or in the future. So even when the outreach is genuinely intended as care and is meant as care, that underlying incentive structure is kind of hard to ignore. And AI-enabled systems are only going to increase this the scale and the speed and the precision of some of these dynamics. So people are increasingly being introduced to futures that they didn't explicitly ask for or consent to or fully understand. And I genuinely believe that many, if not most, people working in healthcare and insurance are trying to improve access and outcomes for patients. But I think the point to make here is that good intentions don't dissolve information asymmetry or the power imbalance that can be there with that information. So the question becomes, what should that interaction feel like? Are there alternatives to that awkwardness and that tension that is there? And so I'll come back to some ideas I have about that, but first want to speak to another challenge with health AI. So right now, many people interact with health AI and health AI-enabled health products through a very narrow interaction pattern, which is that we ask and the system answers. And in my work, I spend a lot of time reviewing consumer health apps, and there are some, I want to show a few examples of how data tracking and AI-enabled interpretation often show up in health products today. One second, let me pull up my slides here. Share. Let's see. Almost lost the share button, but there it is. Okay. Okay, can you see this? I'll zoom in just a second here.
Yes.
Okay. All right. Okay. Okay, so can you all see this? Okay. So these are some examples of how data tracking and AI-enabled interpretation show up in products today. So these are a few screens from some widely used health apps. So for example, Aura, there's one called Olivia, and there's one called Function Health. And so typically these products collect large volumes of physiological data in the case of Aura, or behavioral data, or lab data. And then what they're doing is they're either surfacing the metrics and the trends back to the user. So you kind of see that on the left-hand side. Or as we get more into the world of generative AI, they're inviting the user to query the system for interpretation. So you can see that within the Olivia and the Function apps here. So increasingly, they also suggest kinds of questions that the user might ask of them. So often via chat-like interface. So this can be, there are surfacing questions here like, can you help me optimize my metabolic health based on my labs? Or can you help me understand how I'm feeling today, right? Based on what's going on with my health data. So in many cases, this is genuinely helpful, and it's even life-changing to be able to access your health data in this way. But it also establishes a dynamic, which is that the system holds the data and the interpretive authority over that data. The user asks and the system answers. But AI systems don't have to live there. There are other possible interaction roles that we could take with them. So for example, AI as a question generator for us, AI as a tool to help us prepare for interactions with healthcare providers, or AI as an advocate rather than just an authority in our lives. So I want to show you a few low fidelity concepts we explored during an internal practice session that we did. These are speculative design explorations, and they're not affiliated with client work that we've done. This is just an audit of an existing platform and a reimagining. And it's not client work. So this is, in this first example, this is an example of health organization that with explicit consent might record and capture notes from visits with healthcare providers and generate summaries of those visits, but also generating reminders, follow-up tasks that were mentioned within the appointment, and really being about reducing cognitive load rather than expanding surveillance. So you're really supporting the patient within what you're doing and surfacing things that the patient or the caregiver might be able to gain support from. And then in this next slide, the system could also generate suggested questions for patients to bring to their clinicians, right? So a lot of times we see you have to ask the platform something and it will give you then an answer. But what if AI proactively surfaced questions that you should be asking and allowed you to kind of have that agency with your healthcare providers? And it helps you show up better prepared and asking the right questions rather than only delivering conclusions. Delivering conclusions can be great if you have a question, but sometimes people don't know what question to ask, or they don't know what they should be doing. And it also feels different to ask a question about your own health rather than to just be the receiver of information about your health, right? It feels different. It shifts the locus of power without removing AI from the system. This would be an AI-enabled system. So this is the design question that I'm working with, is how do we preserve and potentially expand human agency and freedom in healthcare systems that are increasingly shaped by prediction and measurement and intervention? So I'll go back to some slides in a minute, but I'm going to stop for just a second. So this brings us to another question, which is, what if AI also just let us be? If health AI is shaping our bodies, our futures, and our sense of self, then design decisions that we make don't just influence outcomes, they actually shape how it feels to exist within the systems that we are in. So let me share an example. I want to share, this is a brief story about an experiment that I created for a conference called EPIC Conference in Helsinki, Finland. And I was speaking about health deification and embodiment today. And because the topic was embodiment, and because we were together in person at the conference, I didn't want to just talk about it. I talk about embodiment, right? I wanted us to experience something with our actual bodies. But I'm not a programmer. I don't have any formal training in coding or in hardware. And so using a generative AI system, Claude actually is what I worked with, as a rapid prototyping partner, along with some expert support from a few colleagues of mine to help me with some tweaks along the way, I designed a simple embodied experiment. And I was actually able to do this almost all on my own. Claude gave me the directions for how to do the code, how to connect the system, how to create the wires. I will show you what it looked like. Okay, so it involved a small vibration sensor that I attached to the participant's body with a very complex system of a hairband around the person's wrist, and very complicated. And as they moved and gestured, a projected visualization of mushrooms would slowly bloom. And this system wasn't measuring performance. It wasn't scoring the movement. It wasn't optimizing anything. It was simply responsive. And people really loved it. I'll show a video in just a second. But as participants engaged with the visualization, something that I hadn't really anticipated happened, which is that there's sort of this gentle sense of relaxation and delight that seemed to take over the room. And I have a short video that sort of describes one person's response here. Let's see if we can play it. If we can't hear it, then I can just say what she said.
More animated.
Yeah. And then as you do it longer over time, then the mushrooms start to come. There we go.
That's quite easy. It's kind of what we were talking about before, that with mood rings.
Yeah.
It's telling us something about what's going on, but it's not right or wrong. It just is.
It just is. Yeah.
Just giving us some.
So I don't know if you could quite hear what she
It was
said.
mixed. It was mixed, the
Okay.
hearing. Maybe you can just quickly summarize.
Yeah. So she's trying it out and she's saying, oh, okay. So the more I move, the more mushrooms generate and the more that they bloom and the rings bloom. And she said basically what she said is it's telling us that something's going on, but it's not right and it's not wrong. It just is. And that is what people seemed to love the most about it. What people seemed to love the most about it is what the system wasn't doing. It wasn't trying to improve them. It wasn't comparing them to other people. It wasn't extracting meaning from their bodies in some way. There was this sort of visible relief that nothing important was about to be revealed in front of people. Like there was no subtle judgment or no public metric, no kind of like quiet humiliation that they were going to be going through. It was just there to have a sort of this sense of delight. And there was watching that collective exhale and an individual exhale made this experiment really interesting for me. And it led me to think about this idea of delight as a design stance for health and health AI. This experiment kind of ended up accidentally being maybe in some way an act of quiet resistance. It's not about optimization, it's not about scoring, or there's no improvement narrative. And that led me to ask, what might become possible if delight is not a byproduct of something that we're designing, but actually a design principle? What if presence itself can be a legitimate outcome? And this is where I would encourage you all to experiment, whatever your background is. I would encourage you all to experiment with vibe coding, quote unquote. By that, I mean, experiment using generative AI as a creative and technical scaffold for you to actually make things and put out into the world, even if you're not a technical expert. Because I believe that researchers and designers can prototype interactions that they wouldn't otherwise build now. We can do things now. We can build things now that we wouldn't have ever been able to build alone before. And through building them, we can explore new social hypotheses through the act of making. These experiments, they're not frivolous. I think they're not necessarily scalable or intended to be scalable, but I think that they can be acts of epistemic resistance, actually, challenging the kinds of knowledge that we treat as valid and measurable and valuable. We can create these experiments to show things that are new about the world that are not being considered within the dominant paradigms. Not everything about this experiment felt good, and that matters. I want to share a story about doing this with my colleague, which is that after the conference, one of my colleague that worked with me on it, who does work deeply with AI and physical computing, he told me that the process was a little bit unsettling for him and it made him a little bit uncomfortable, not necessarily in a bad way, but he just wanted to talk about it. And so we talked about it, and he said that before generative AI tools like this, I would have needed to involve him earlier. I would have been relying on his expertise to shape the problem, the narrative, and the technical approach. And this time I arrived to him with a largely formed prototype, and I was asking him for help in executing it. And what I unsettled him about it wasn't necessarily that he was being bypassed or anything like that. It was more that there was this sort of uncoupling of empowerment and mentorship that had shifted. So for most of his career, democratizing knowledge and democratizing access to technology had meant making and teaching and learning in this shared way. So he would be mentoring someone that wanted to learn more about technology. And this experiment kind of surfaced this new reality for him, which is that people can now build without learning in the same way, or without having that mentorship in the same way, and without some of those relational processes that once accompanied that learning. And that tension's not simply about just AI and expertise, but it's also about what gets lost when tools remove the barriers to making, and also the human practices of collaborative framing and teaching and sort of collective sense making that can happen. And discussing it, I think where we landed is we don't see this discomfort as a problem to fix necessarily. We see it as a signal. There was this productive tension that can shape, we think, new forms of collaboration as AI becomes both the co-creator and the enabler. And we think it raises important questions like, as AI is able to scaffold novices into creators, what does it mean to be an author or an actor in the world? How are we shifting roles between experts and non-experts in what we're doing? And what new collaborations or frictions might be on the horizon as we emerge and from in this world, and how might those boundaries blur between who can make and who can't make? There's also a lot of excitement here, especially I think for people who have historically been excluded from technical making. So I was a little bit excited about his discomfort, actually, because I think for me, in previous times, I might have gone to this colleague, and I think we would have come up with something, no doubt we would have come up with something even better than what I created on my own. But I also wonder if my design intent would have been fully articulated or visible if I had gone to him sooner and he had helped shape it from the beginning, because then my design intent, which I hadn't fully articulated or realized yet, which was something about this design for design's sake, or design using data for a sense of delight. I hadn't been able to fully articulate that, and that may have gotten edited out potentially by collaborating with a partner earlier. And so I think that there's a lot of potential and excitement for people that haven't necessarily been in technology. Technology is a very male-dominated field. It's still very male-dominated, still very white field. And so I think that there is some real excitement about people being able to make some of these things on their own. And there's also this sort of warning, I think, about lost relational knowledge. So my loose recommendation is this, which is build the thing you need to build to articulate your intent. You can actually build things now to show your design intent in ways that you never could, and in ways that you always had to rely on designers to do before, right? And then after you build the thing to articulate your intent, then bring in experts. So build it quickly and then bring in experts to help make the next better version of it, but use it to be able to articulate what you're going after. So transitioning a bit here, what does all of this suggest about the future of data and AI? In talking to people about the work that I've been doing, the words, I think, refusal of datafication and resistance to datafication have come up a lot. People are saying, oh, this is really interesting because it's almost like it's refusing datafication, it's resisting datafication of bodies. And I think that that is true, but I also would argue that those words of refusal and resistance don't quite articulate the potential that I see. I would argue that this is about what I'm starting to call and frame as, I'm playing around with the idea of framing it as transmutation of datafication. Transmutation of datafication, because I believe that what we need is not necessarily the rejection of data and what data can do for us. I believe maybe what we need is more of an alchemy that transforms raw data into emotionally resonant and agency preserving experiences rather than simply rejecting that data. There are other ways that we can use this data that create almost a sense of magic, that create almost a sense of presence within our bodies and delight with what our bodies can do and could do in the future. So to summarize a few points here, one, I think doing nothing with data, quote unquote, doing nothing with it, or using it to just create delight or presence rather than judgment is not actually doing nothing. It's doing something. It is radical and felt intervention that means something to people and people experience differently. Doing nothing with data also has the potential to create alternative emotional and somatic states, I believe, that then those emotional and somatic states may actually have more generative potential for people to create and have agency within their own health or alternative potential. And I believe AI-enabled systems could accompany us towards health rather than constantly assessing and optimizing or aiming to correct us. They could help us retain and even grow new forms of human agency within the complex healthcare systems that we live within. So to conclude here, if AI is shaping how we move and how we make and how we care for ourselves, then the futures that we are building are not only going to be technical, they are going to be felt. And maybe one possible future for AI and health isn't louder or more about optimization and faster. Maybe there are futures that are quieter. Maybe it accompanies us along our trip rather than evaluating us. And maybe it lets us be human without simply turning us into data points. Thank you.
Thank you, Brenda, for a really rich and thought-provoking talk. Gives us a lot to think about. I will end the recording now because that is the end of your presentation and we don't record the discussion. So I say goodbye to whoever will be looking at that and listening to that. Thank you for also looking at it later. And let me find the button.
Thanks so much for having me.